Thank you. Dr. Bessler.
One of the things that many people do not realize is that the best area for competition is between hospitals and between physicians. Many places in the country, physicians will have two fee schedules. One, if you have insurance. Two, if you don't use the insurance and don't cause them to go through the paperwork and get simply 1/3 of the bill charge back in payment, they'll reduce the bill by 50%. Right now, that occurs. It points up the wastage that goes into managed care. We can help fix the health care financing by ceasing to treat managed care third-party payer the problem as if it is the solution. For the past 50 years, we as a nation have been tinkering with the funding of health care delivery by various third-party controls over the transfer of payment. The result has been progressively more costly and more chaotic financing of health care. It is time to stop the managed care fixation and return the issue of paying for health care to the patient in a realistic patient-to-provider negotiation. It's called Medical Savings Account, or HSA, Health Savings Account, and was proposed as early as 1994 by health economists John Goodman and Gerald Musgrave in their book, Patient Power, which you can probably pick up on the internet. Medical Savings Account system has been field tested and is functioning with great success in the city-state of Singapore for more than 20 years. We turn to Germany, Britain, Canada. Singapore is an operating example of medical savings account. Medical savings account system allows the individual or the employer to place into escrow for the patient a tax-exempt amount of money, for example, $5,000 each year, from which to pay the relatively small medical expenses incurred throughout the year. This escrow account belongs to the individual in whose name it was established and who retains ownership of it even if he or she does not spend it on health care. The unspent balance may remain in the person's escrow medical savings account at the end of the year, or the individual may spend it on a non-health care expense, at which time that portion becomes taxable, whereas an insurance premium, once paid, is gone forever. The ownership of medical savings account remains with the individual. And I'm going through this step by step because this is very important in your thinking of how can we offer a solution other than that's coming out of Washington. For health care expenses that exceed the amount of money in an individual's medical saving account, the individual buys a high deductible catastrophic insurance coverage. For the poor, the federal and or state funded adaptation of the medical savings principle and catastrophic insurance can function as well or better than Medicaid. And they've done this in Singapore and are doing it. Healthcare costs can be dramatically lowered by transferring power from impersonal bureaucracies to individual patients, thereby restoring the buyer-seller relationship. You bargain over an automobile, you bargain over most big expenditures like your house. Why should we be timid about not bargaining with our doctor or with the hospital over their charges? They'll drop it in a good negotiation exchange. The Patient power restores the patient to the position of controlling his or her own MSA money in negotiating healthcare costs with healthcare providers. Therefore, if healthcare consumers are allowed to save and spend their own money, and if doctors and other healthcare providers are allowed to act like entrepreneurs, if we let the market work, there is reason to believe healthcare costs will not rise faster than inflation. Now they rise twice, 3 times inflation. Premium charges go up that rapidly on low deductible insurance. It will certainly help in turning our present upside down healthcare financing right side up again. This puts the patient back in the driver's seat. It's your money. You can send it to Washington as taxes and hope you get 25 or 50 cents back in services, or keep it yourself and negotiate with your doctor.
As you can see, ladies and gentlemen, the solutions are relatively simple. The problem is not all that complicated either. We simply need to get the federal government out of the way of our healthcare decisions. Healthcare needs need to be returned to the basic economic principles that govern the sale of other necessities of life, including food, water, clothing, transportation, heating and cooling, and housing. Free markets work, bureaucracy and socialism and politicians do not. Personal responsibility is essential to saving health care and returning health care to an ownership society. Medical savings accounts that have been mentioned, portable health insurance policies that can be taken from job to job are major reform steps on the road to an ownership society and a health care system that works for all of us. As most people do not understand economics, and that includes most politicians, and they fear change, any reasonable solutions will be difficult to implement. Fundamental to health care discussions and decisions, I propose 5 simple solutions. Number 1, we must block any additional incursion of our federal government into the control and funding of our health care. In fact, we need to get them out as fast as possible. Number 2, we must return health care decisions to the people and to their physicians. Number 3, ownership of one's own health care funds and health care insurance are essential steps in our return to a free and economically successful society. Number 4, health care for the poor needs to be put in the hands of the communities and the states. Local people can best provide for the needs of their neighbors who are in need. And number 5, tort reform is essential. We still have greedy trial lawyers out there who are increasing the cost of health care. It's time to get government out of our lives. It's time to return Washington to leaders who are wise, honest, and courageous. Our elected officials must find the courage to return health care, our retirement, education, welfare, and other personal and local decisions to the people, the communities, and the states, where under our Constitution they rightfully belong. The people can best make their own decisions, not some nameless and faceless bureaucrat in Washington, D.C. As I said before, Thomas Jefferson said, and I quote, "Whenever the people are well informed, they can be trusted with their own government. Whenever things get so far wrong as to attract their notice, they may be relied upon to set them to rights," end quote. That, ladies and gentlemen, is you. That is we, the people. Ladies and gentlemen, that is why we've come here together tonight. The politicians have created our greatest problems in this country. The politicians have not provided us with workable and beneficial solutions. The politicians simply need to get out of the way and let we, the people, get back to work. The people and the free markets will quickly restore our country and its prosperity. If the politicians do not get out of the way, they need to be fired as soon as possible. We have gathered here tonight, thank you. We have gathered here peacefully tonight because there's a growing concern for what our government is doing to us and to our future. We fear for our health care and for the very survival of our republic. Yet, there's a lot to keep us hopeful and to fill our hearts with optimism and courage. This is still our country. The Constitution of the United States belongs to we the people. Our Constitution still protects us from our government, including our president. Now is the time for action. Call your elected officials. Call the president. Call the vice president. Call Nancy Pelosi. Thank you. God bless. God bless America.